Good day to everyone. I'm Dr. Enrique Gomez from Mexico. I'm a neurologist in the National Institute of Neurology and Neurosurgery in Mexico City, and I will be talking to you about the plasmapheresis management in NMOSD patients. As you may know, NMOSD is a humoral-mediated disease that attacks the central nervous system. The proposed mechanism of PLEX management in this patient is the removal of different molecules that may take part in the process of damaging the central nervous system, such as autoantibodies, complement proteins, and immune complexes. We now know that the role of PLEX in acute attack or relapses of NMOSD, but what we aim to describe with this study was the efficacy of this procedure in Mexican population. In this study, we will collect data from every NMOSD patient that underwent PLEX since its introduction at our institution in 2010. Every patient was diagnosed with NMOSD based on the Wingerchuk 2015 criteria, and by protocol, every patient in a relapse of NMOSD were treated with IV steroids. In discretion of the treating physician, the PLEX could get started concomitant to that. Due to the distribution of our population, we base our analysis in non-parametric tests. In this slide, we now look at the basal characteristic of our population, and as you can see, we found a total of 89 patients with a mean age at the moment of presentation of 38 years old. We found a higher predominance of female sex with 70%, and regarding the clinical syndrome at onset, we found a higher percentage of patients with myelitis, extensive or short, followed by optic neuritis or bilateral optic neuritis. 27 of the patients were known previously as patients with an NMOSD diagnosis, and the mean time from symptomatic onset to PLEX was 20 days, with a mean number of PLEX cycles of 5. In this graph, we now look at the comparison of the response of PLEX measured by the EDSS, and we found a significant decrease of the median from 6.5 to 6. Of course, this is influenced by the clinical syndrome due to the EDSS being a scale that focuses predominantly on the motor aspects. But when we look for the change regarding the clinical syndrome at onset, we practically found the same finding. A significant decrease in the EDSS, who seems to be more important in patients that started with optic neuritis or Bernstein syndrome. We also look for the effect of PLEX based on the number of cycles, and as you can see here, with every subsequent cycles, the confidence intervals is smaller. This data may suggest that the efficacy is increased by every new cycle that we apply on the patients. It is worth mentioning, of course, that this data may be biased because the more severe the patients tends to be, we treat it with a greater number of PLEX cycles. As conclusions for this cohort, we found that a significant decrease in the EDSS with treatment with steroids and PLEX. In addition to that, we observed that the results was also correlated with the numbers of PLEX cycles, and that the benefit of PLEX was also independent for the clinical syndrome at onset. So we believe that the PLEX appears to be an effective therapy during relapses in Mexican NMOSD patients. Thank you very much.